This is Michael Ostrolenk, and I'm talking to Dr. Marc Micozzi. He is the author of the new book, Your Emotional Type, Key to the Therapies That Will Work for You. How you doing, Dr. Micozzi?
Hi, Mike. It's great to be here. Thanks for having me, and
Great.
appreciate the chance to talk about our book. I do want to mention the senior author is Michael Jauer, Jawer, so it's Jauer and Micozzi on the Your Emotional Type book.
Well, you have a new book out. You're also the author of a few other earlier books, similarly minded, as well as more broadly on complementary alternative medicine. You just want to give a plug for your other books as well before we jump into this one?
Just coming out at the same time with the same publisher is a book with Donald McCown. I worked with him at Jefferson Center for Integrative Medicine in the early 2000s, and that book is called New World Mindfulness: From the Founding Fathers to Emerson to Thoreau to Your Personal Practice. And this book points out that what we think of today as mindfulness, meditation, really has a tradition in America going back to the Founding Fathers, Adams, Jefferson, and others. And then in the American letters era, Emerson, Ralph Waldo Emerson, Henry David Thoreau, these are all people who wrote about the philosophy of what we would call mindfulness today. And so it has very strong roots in the American tradition. It isn't just a foreign import, as we sometimes might think of it. And of course the Founding Fathers and Emerson and Thoreau were exposed more or less to the writings of the Asian scholars, which at the time they called Asiatic or Hindu or Oriental in general. But that those writings were translated in that era and made their way into some thinking. And certainly some of the practices, many of the practices that we would consider today to be mindfulness meditation are very much a part of the history of how early Americans went about thinking about things, literally.
That's very interesting. I actually look forward to having you back, hopefully in the very near future, because I'd love to go more deeply into that book. You're also the author of The Spiritual Anatomy of Emotion.
The Spiritual Anatomy of Emotion was actually my first book with Michael Jauer, who's the author with Your Emotional Type as well. And this is really quite a impressive tome that really goes into the thousands and thousands of scientific references about how the brain functions, our new understanding that what we think of as the mind or consciousness isn't something that just sits inside of our heads, but that is reflected in the entire body. That gut feelings are things we're actually having in the gut, that our heart actually does feel things, and many things that are commonly accepted in literature and art about how we feel, in fact, is now being proven by science, by modern science of the brain, neuroscience. And basically the idea that the mind is somehow separate from the body is an idea that really needs to be retired. And even our common sense, it stands to reason that we think using our entire body, and people have written about different ways that this can happen. I just spoke at Georgetown this morning, and one of our colleagues there, Candace Pert, who actually worked with Dr. Snyder previously, who won the Nobel Prize, she probably should have shared it, for the discovery of neuropeptides and finding that these chemicals that we think were confined to the brain are actually present throughout the body. And so that nervous signals go back and forth through these chemical messengers, through the nerves themselves, the autonomic nervous system, which travels to every part of the body. It all works together as an integrative whole. There are actually more neuropeptides in our intestinal tract than there are in our nervous system. So again, the molecules of emotion are things that exist throughout the body and are constantly circulating throughout the body and make up what we think of as consciousness or mind, which instead of localizing it all up here, it's really all out there and perhaps even beyond in terms of the energies that we project and sense and feel among other people, between a healer and a patient, and in various types of experiences that are commonplace to many forms of healing that people have called alternative, but in fact are really primary care for 80% of the world's people and through 80% of human history.
And you also are the author of a textbook on complementary alternative medicine, is that correct?
Yes, I'm editor and I write a lot of the chapters with many expert colleagues. a textbook, which is the one that's being used in the medical schools. They're using it at Georgetown, and where I also teach out from my textbook, and that's Fundamentals of Complementary and Alternative Medicine. It's in the 4th edition. It's been in print now for almost 20 years through succeeding editions. The foreword is written by Dr. C. Everett Koop, who was the Surgeon General and my boss here in Washington in the 1980s when I worked during the Reagan administration. And before that, Dr. Koop had been my professor at the University of Pennsylvania. So he writes the foreword, and the 4th edition of my textbook has another foreword from Dr. George Lundberg, who was the editor of the Journal of the AMA for 20 years, and basically says that, you know, what works is not alternative or complementary. What works should just be known as good medicine. So we really point out how, if you look at the better safety and the effectiveness and the really pleasant environment where so much of alternative medicine is provided, it really is good medicine.
And now you have a new book out, Your Emotional Type, Key to the Therapies That Will Work for You. Explain the new book and the concepts behind it.
This new book really has two outgrowths. I think it sort of took two things to come together. Part of it was the tremendous background that we assembled for this big book on the spiritual anatomy of emotion, understanding better the mind-body connection, different what we call boundary types, which comes out of the psychometric field. A lot of people in management, you know, understand psychometrics from their use of the Myers-Briggs scale or the Minnesota Multiphasic Personality Inventory. These are all highly scientific, from a statistical sense, instruments, and we were able to use some of these types of instruments to better understand people's emotional types that relate directly, we think, to their style of mind-body functioning and the kinds of problems that they're susceptible to and the kinds of therapies that are going to work for them through this type of analysis.
Can you give us ideas, kind of a breakdown of the different emotional types that you've discovered?
Well, basically, the key is that everyone's an individual. And so rather than basically saying there are a certain number of types, there are essentially an infinite number of types along a spectrum. And so everyone falls somewhere on the spectrum between what's called the thick boundary and the thin boundary. And so you fall in between, and that's the key, is that it stands to reason that if everybody's an individual, then they're going to fall at different places in the spectrum, and also different therapies are going to work for them. One of the biggest challenges we've had, in addition to understanding the mind-body connection, is the reality in practice when it comes to alternative medicine, complementary therapies, mind-body therapies, that they do not work equally well for every individual. And we've known this, and I mentioned in the book one of my most dramatic experiences was when that first textbook we talked about, the Fundamentals of Complementary and Alternative Medicine, when that came out, it was kind of news because 15 years ago it meant, well, doctors are finally learning about complementary medicine. All the people are doing it. Now the doctors are finally going to learn with this textbook, with the Surgeon General writing the foreword. So it was newsworthy, and I remember I was waiting in the green room, and that in the green room that day was Placido Domingo, and Placido was interested. He was just, I think, transitioning from the Metropolitan Opera to running the Washington Opera, so that was kind of big news. And he told me how interested he was in alternative medicine, which is typical of people that are educated, smart, have the options, have the ability to look at other options, almost universally find something here, that speaks to them, that makes us, and actually that works for them. And I remember we had a little joke, and I said, well, Placido, you know so much about the subject, why don't you go talk about alternative medicine, and I'll try to sing. I said, I know an aria from, the Marriage of Figaro, but yeah, so we had a good time. But when I went on there, I had a very favorable audience, Charlie Gibson back then and Joan London, and they were very fair and open about it. And of course, back then we were constantly being attacked. Mm-hmm. Well, you're a doctor, you're a scientist, how can you believe in this stuff? And I'd say, well, as an anthropologist, we have respect for these traditions, they make sense, you have to understand them. And as a scientist, I believe in facts and evidence, not theories. And just because you're trying to tell me that something doesn't work because it can't work according to your system of thinking, when in fact we can see with our own eyes that it does work. So we're trying to in fact be scientific, that is, believe what we see with our own eyes, whether we think we can explain it or not. There it is. So I went on, and I remember Joan saying that she had had a problem with her shoulder, I think a horseback riding accident, and she went to someone, and her friends recommended it. It worked for her friends. The doctor thought that he could help her. She thought, and it didn't work. And it got me thinking, and there I was on live national television saying, doctor, why didn't it work? And I didn't have a great answer for it, except that I knew that everyone's an individual. But what I've known ever since, and what I've talked about until this book, is we need to figure out, we need to find a way to understand and predict what therapy is going to work for someone and what isn't. Because let's be honest, not everything works well for everybody. And so part of the issue has been proving, is there evidence and is there science that this is a safe and effective therapy in general? Okay, now, if this therapy is worthwhile, let's find the right one for each person, because we say that everybody's an individual. Well, if everybody's an individual, it stands to reason that different things will work for different people. What kind of basis can we provide them? Hypnosis is an interesting example, which we include in this book. Hypnosis was developed by Franz Anton Mesmer in Vienna, and he was talking about animal magnetism and the fluidum and some of those ideas from over 200 years ago as to animal magnetism or vital energy. These are things Benjamin Franklin and other people were interested in. Alexander von Humboldt from Germany, the leading scientific minds, were all interested in animal magnetism or vital energy. Mesmer found a medical application where he felt that by hypnotizing people he could affect their health. And it was very controversial. He came to Paris, which was the center at that time, right before the French Revolution, under Louis XVI, and they actually convened a panel that included Benjamin Franklin, who was our U.S. minister to the new United States, minister to France, the court of Louis XVI, between our revolution and the French Revolution. We had Antoine Lavoisier, who had understood basic things about chemistry, serving on this panel, and Joseph Guillotine, who later became famous for developing a more humane way of executing people that became quite popular when the revolution hit. Anyway, they had this great, the scientific minds of the era to study hypnotism. And before they could actually do the studies, they fell into disagreement over arguing that, well, it couldn't work. So instead of actually observing whether or not it worked, they spent all their time arguing whether or not it could work theoretically. And of course, this has been the big debate in medicine between theory and practice all along. Rational medicine, finally the tradition that we have, where we have bedside teaching so we can actually see with our own eyes. And so this was what happened with hypnotism, but it was used for 200 years. No one understands how it works, the mechanism of action. In other words, you give a drug to somebody, we think we can explain at the cellular basis, the chemical basis, how it's actually having an effect. Hypnotism, how do you explain how it works? We just know that it does. So in that regard, about a generation ago, Spiegel at Stanford University actually developed a way of assessing hypnotic susceptibility, the hypnotic susceptibility scales, which are just simple questions that you ask, that any doctor could ask in a patient survey, or any person can answer for themselves in a survey. And based upon your answers, we know that about 10% of people are susceptible to hypnosis, 10% are impervious to hypnosis, and everyone else falls in between. Well, now we've found a way, by putting together the mind-body research and the 20 years of research we have on the different mind-body therapies, we have found a way to assess if someone's going to be susceptible to a particular therapy or whether they're not going to be. And so that's what we have really been able to do with this book, is give people that tool.
You mentioned there's a spectrum between thin and thick. Can you explain and define thin and thick?
In terms of what you might relate to, someone who has thick boundaries, it's what you would kind of visualize. Nothing gets to them. They're impervious. They just carry on. They're very stoic. They just keep on keeping on. And what we don't know, though, is that inside there may be incredible turmoil and that they're masking it. And that has its own serious consequences in terms of health problems. But they're going to be manifest a certain way. And so the thick boundary person may not even be aware of the turmoil going on inside and may give various clues as to changes in blood pressure and blood flow, but you wouldn't know it unless you were doing medical monitoring. The other end of the scale, the thin boundary person, would be what you would think of as the extreme empath, the extremely empathic person. I don't know if anyone ever saw that movie with Tom Cruise called Minority Report, where they actually have learned, the police have learned to use empaths who are so sensitive to vibes, if you will, that they actually feel vibes of violence before anything actually happens. And they have, a short window of time to pick up on the violence and image it and then try to intervene. That would be the extreme empath who's just so sensitive. You might say, kind of the Bill Clinton type, and that, I feel your pain. That this, if we really believe that. But there are people who do feel other people's pain, and these are the empathic types. And, they kind of wear their heart on their sleeve. We all have these cultural expressions, and in literature for understanding these types. But what we have now is an objective way through psychometrics, through this personality boundary survey, to actually put you as an individual on the spectrum and then relate that in turn to different types.
Okay, so if our viewers are very interested in finding out where their emotional type is, which I assume they would be, how do they go about doing so?
There's actually three ways to do it. The book itself, right in the middle of the book, after giving some background, in the middle of the book we get to the point where you really have to take this little survey to find out your boundary type, your emotional type, and then as you go on and read the rest of it, of course, it's a richer experience. That's based upon a very short survey that we distilled from the longer instrument, which is hundreds and hundreds of questions. It can take hours to do it right. We give you the full survey at the back of the book. But what we found in our research is that you don't have to answer the hundreds of questions. By picking a subset of questions that are highly correlated to the overall outcome, this is what you call factor analysis. You can see how each question individually, how the answer to that relates to a score if you did the whole questionnaire. So based upon the questions that, for whatever reason, statistically are most predictive, you can actually do a very short, easy survey and come up with your type very quickly. So we do that in the center of the book. If you want to learn more about it, you can also just go to the website, www.youremotionaltype.com, and you can actually take the survey online and learn more about this and more about the book itself.
Now, is where someone lands on the spectrum from thin to thick, is it situational, or is it concretized in their nervous system and that's how they are in every situation?
That's a very good.
Something between.
That's a very good point. Actually, both things happen. We find it's kind of like your familial inheritance. I mean, to some extent, you carry it with you, but it can change a little bit over time. It can change in different situations a little bit, but there are some degrees of freedom. But you're not going to have a dramatic change from one end of the spectrum to the other. So it's fairly consistent through people's life.
Are there some of these practices within the complementary and alternative medical sphere which then can actually be used to slightly modify? So if you find yourself more thick and you kind of want to open yourself up to your own internal self-sense and kind of emotional connections with other people, you can do certain practices and that will open you up.
Well, that's a very good thing. I mean, what we focus on here is that if you have a certain type and that's associated with the problem that you're having, we give you different therapies you can try that will certainly alleviate the problem.
Can you speak to, like, if someone is more thick, like on that side of the spectrum, are there certain therapies that you'd recommend? I mean, how do you first define the therapies that are in your spectrum of possibilities for anyone? What are they? And then kind of how do they fit?
We had the data, going back 20 years, looking at all the studies and kind of ranking them and ordering them. We were able to look at essentially seven therapies. And it's what we often call mind-body therapies. We are talking about the mind-body connection. So we're not talking about things like herbal remedies here. but more in the area of mind, body, and things that influence perhaps your energy flow in some ways of thinking about it. So of course we looked at hypnosis, and that's something where it's a very thin boundary. It turns out the people that are susceptible to hypnosis are ones with thin boundaries. Things can get through to them. Suggestion, hypnosis is just the power of suggestion. People are suggestible, so a thin boundary person's hypnosis is going to work. Thick boundary, it's not going to work for them. Most people fall in between. Another example would be biofeedback, where that works well for thick boundary people, it turns out, because these are people who don't have a clue what's going on inside. And they're also, they're very concrete thinkers, rational, think of themselves as rational. I'm fact-oriented, information-oriented. I'm all about facts and not feelings, So the thick person is facts and not feelings. The thin person, much more sensitive to feelings. So a thick boundary, fact-based person responds well to getting data. Okay, here's feedback on what's actually going on inside of you. Here's your blood pressure, here's your blood flow, here's your body temperature. Look what's happening. By getting, so we think there's two things. Biofeedback is a good tool in general, but the thick boundary person, especially, it gets through to them because here's information. So first of all, we clue you in to what's going on, but secondly, you take it seriously because you're a fact-based kind of person, and here's some scientific data for you. So we think that's how biofeedback is helping the thick boundary person. What's also very interesting here is we talk about acupuncture. And a lot of the focus, of course, is the effect of sticking a needle through the skin. We've done an analysis of acupuncture that's much more of a mind-body. We feel that acupuncture, like most alternative remedies, it has a strong mind-body component. So the analysis in this book looks at acupuncture as a mind-body therapy. And what's interesting is that it's extremely effective. It's so potent if it's done right that it gives just about anybody some benefit. But again, depending upon where you fall on the spectrum, maybe a little more helpful than for another person. So what it really tells you in the book is, if you're on the spectrum, this is probably what you ought to want to try first. And maybe this is something that might not be your first choice. It's a tool to guide you in terms of spending your time and your money wisely, and what are you going to invest in believing this is going to work. It isn't just the placebo effect. If people, if the placebo effect explained alternative remedies, then if you believed it would work, it would work. But we have case after case where, the person wanted it to work, expected it to work, needed it to work, and it just didn't work for them. And that's an important, one of the sort of open secrets in complementary medicine is that not everything works for everybody. That shouldn't be a surprise, because one of the commandments of alternative medicine also is everybody's an individual. Well, if that's true, then let's just go ahead and admit that every therapy isn't going to work as well for every person. We just never really had a tool, that's easy to use, but also science-based to help guide people to the right therapy for them as an individual.
This is fantastic. So people can visit your website, which is
www.youremotionaltype.com, same as the book, Your Emotional Type.
And do you personally see clients or patients?
My practice is a consulting practice, so usually I'm consulting, the doctor's doctor. But actually, because of people reading this book, they've wanted to come see me, and I'm saying, well, if it works, you just take the survey, but they still are so fascinated, they want to explore it. There's so much, as you can see, the size of this book versus the size of this book. I mean, there's a lot more, but if you're going to make a book that's accessible to a lot of people, you sort of have to keep it simple, and that's what we've done here.
That's great. A question for you. I did my postgraduate work in somatic psychology. This is almost 20 years ago, and I studied Kellerman's work. He's one of the post-Reichian guys who looks at body structure and working through the body structure in order to affect psychology. I don't even know if my languaging is correct in the way he would describe his own work. But I'm curious, your emotional types, do you notice that along the spectrum that they manifest how people organize themselves physically in space and move in the world?
In terms of the information that we derive to formulate this emotional type, the personality boundary survey, it's more about how you experience the world than how you manifest yourself in the world physically. That would get you into a lot of these very interesting bodywork techniques and some of the orgone therapy, Reichian therapy, different things which certainly give us insights into energetics. But in terms of really keeping a simple psychometric survey, as you would say, the science of psychometrics is really not behind the theory or the paradigm. It's really just statistics. It's pure empiricism. Statistically, this is what it looks like. And when you can't really explain, I don't think I could explain to you today how hypnosis works. But because of the Spiegel hypnotic susceptibility scales, we can predict, well, it's going to work for you, and it's not going to work for you, and you might be willing to give it a try, but it wouldn't be at the top of your list, depending upon your hypnotic susceptibility. It turns out that then relates to thick or thin, and we're able to look at 6 other big mind-body therapies. And I want to say about those other therapies that we're not looking at experimental things. These are well-proven, safe, effective, widely available. That's the criteria for limiting it to what we call the Super 7 therapies. They're out there if you want to get them. The question is, point you in the right direction, and go to your doctor. And if the doctor thinks that there's nothing to it, ask them to take a look at this or our website. We give you the science as to why this is a reasonable kind of assessment to put a tool in people's hands that we've needed for a long time, because not every therapy works equally well for everybody, and we need to bring alternative medicine to the next level. It's one thing to say that we have evidence and research, and that's wonderful, but now let's match it to the patient. Let's do the patient the favor, do yourself the favor, because you can find this out on your own by taking the survey. What's going to work for you? We owe that to our patient ourselves. This is the next step of if we truly want to improve the practice of what's called integrated medicine. When the doctors bring alternative therapies into medical practice, integrated medicine, then they need to do a good job of directing patients to the right therapies.
What kind of feedback are you getting from integrated medicine practitioners, whether they're doctors or chiropractors or osteopaths or whomever, that are utilizing your program?
Well, I'm getting, the feedback is pretty good. I have thousands of contacts, and I've been out there with them, and I've had I'd say about 50 people get back to me saying that this is something we've needed. In the publishing world, Publishers Weekly said that, complementary medicine books have been a big thing, in publishing. And a lot of the books, frankly, they're sort of one person's opinion. They don't, what's sort of caught on here and there. They don't really have the science. They certainly don't have a sort of ethnomedical perspective, understanding where these traditions come from. But they just kind of caught on. And so, as a doctor, I could just have my own opinion. But, we've spent years doing the research behind this. And so I think Publishers Weekly, that when they said it's a breakthrough book heralding the next phase of alternative medicine, which is correct. I mean, I've done about 25 books myself, mostly textbooks, and you don't need just one more guy's opinion about I tried this in my practice, or I do this personally and take my word for it. This is based upon the science of psychometrics, which really, as much as we use psychometrics in management and so widely throughout our society today for matching people to jobs and management styles and positions. I mean, well, here it's matching it. It's taking a psychometric instrument, taking that science and applying it to alternative medicine, which has never been done before.
Well, thank you, Dr. Micozzi. Your new book, Your Emotional Type, Key to the Therapies That Will Work for You, and the website one more time?
www.youremotionaltype, like the book. And this is an interesting, I mentioned Dr. Koop, if you have a little extra time. This image, it's so interesting how this image came about. Because 20 years ago, when I was working with Dr. Koop to do the first national education exhibit on AIDS that went to science museums around the country, seen by 50 million people, that was a tough subject, AIDS, HIV. How do you get across to people? And working with the best science museums who are experts on visual displays and such, they came up with a drawing that was very much like this to say, look, dealing with AIDS type of thing. I was amazed that when we sent this manuscript to our publisher, they went to their art department and they independently came back with this cover which is very similar to what we found 20 years ago with Dr. Koop. And of course, you have the 7 little pinwheels in the head that represent the 7 mind-body therapies. So we think it's a very interesting design, and it maybe communicates to people that, you know, it's not pleasant having the medical conditions we discuss in this book, 12 of the most common chronic medical problems today that are not well addressed by regular medicine or drugs. But it doesn't feel too good, but we have help on the way for you.
Could you just briefly go through some of the 12?
We have basically, we looked at asthma, allergies, chronic fatigue, fibromyalgia. Instead of lumping chronic fatigue and fibromyalgia together, one of the great discoveries we made in this analysis is that chronic fatigue and fibromyalgia are in fact opposite ends of that spectrum. That if you're exposed to certain kind of stresses, if you're a thick type, you get at one end of the spectrum, you get chronic fatigue. If you're a thin type, you get the fibromyalgia. And so it's given us some insight into a real challenge, as common as it is, the lumping together of chronic fatigue, fibromyalgia. And what we see is that the difference is in your emotional type, how you're going to experience that illness, if you're going to be at one end or the other, or somewhere in between. So we get into that. We talk about chronic pain, post-traumatic stress disorder, trying to get some information through the military channels. That's such a big problem. Our family works with the wounded veterans, so there's a lot of help there. Phantom limb syndrome, which is kind of a subset of a lot of wounded warriors as well. So we're hoping to get somewhere with with our veterans who've been through these very difficult experiences. We talk about headache, we talk about psoriasis and other skin conditions. You take 12 of the most common problems that aren't well addressed by regular medical care or drug therapy, and we talk about it in terms of guiding you to the right therapy that's going to be effective and safe for your problem.
Great. Thank you, Dr. Micozzi.